How to do a Stoppa approach. A Stoppa approach is assess the quadrilateral space to the buttress community in medial wall fracture. It is basically a lateral window approach, thus avoids inguinal canal dissection. So basically assess the quadrilateral plate to buttress community wall fractures. First of all, insert a Foley catheter to deflate the bladder, 15 cm transverse incision 2 cm above the pubic symphysis. Split rectus abdominis along the linea alba or partially detach it. Allow middle window of the inguinal approach to be avoided, resulting in minimal dissection of inguinal canal, femoral nerve, and external iliac vessels. So you incise split rectus abdominis along the linea alba or partially detach it. You reach the retropubic space of Retzius, extrapleural space located posterior to the pubic symphysis and anterior to urinary bladder, separated from the anterior abdominal wall by transversalis fascia and extend to the level of umbilicus. Flex the hip and the knee to release iliac vas. Risk is to corona mortis, tie off, otherwise it retracts and there is obturator nerve, bladder and iliac vessels. Regarding the iliofemoral approach, it's the one of the most approach which can attend both columns, anterior column as well as posterior column. It can be used for pelvic osteotomy and THR. The incision mark is in posterior suprailiac spine to anterior iliac spine and then goes down on the femur. Complication is hypertrophic ossification of superior gluteal artery injury, resulting in gluteus medius necrosis. Ilioinguinal approach is for the anterior acetabular wall and column fractures. Both columns can be identified if the patient is supine plus with a catheter. Incision is 4 cm proximal to the pubic symphysis to the anterior suprailiac spine 2/3. Divide epineurus of external oblique muscle. Divide ilioinguinal ligament and iliopectineal fascia. Release rectus abdominis muscle. Release iliacus muscle. Insertion from the ilium subperiosteally to sacroiliac joint. Now bluntly dissect plane between the symphysis and the bladder, space of Retzius. Corona mortis is a retropubic anastomosis on lateral third of the superior pubic ramus. It's basically an anastomosis with obturator and external iliac artery. Ligate it with lega clips. Now 3 windows are created. Lateral window, iliac wing to iliac vas muscle. This from sacroiliac joint to ilium can be identified and assessed. Middle window, iliac vas to external iliac vessels. This window creates opportunity to see quadrilateral space. Then medial window between the lymphatic external iliac vessels and rectus abdominis muscle. It helps to assess pubic symphysis. Risk is femoral nerve and artery, lateral cutaneous nerve of the thigh, spermatic cord, inferior epigastric artery, and genitofemoral nerve.